Kagusha's statement will be, is Ngogoyo here? Sorry, Tongoyo?
Yeah, Honorable Speaker.
When can you respond?
Yeah, Honorable Speaker, maybe before I do, it is unfortunate you keep referring me to confusing with Ngogoyo.
Yes, your names are almost similar.
But he's a bad guy.
Yes.
Anyway, not to the withstanding, Honorable Speaker, considering the much backlog that we have before us, and that...
This is a song about a breakup. This is a song about a breakup.
Within 3 weeks, Honorable Speaker.
3 weeks?
Yes, please.
Order, Honorable Kagusha, you'll get a response in 3 weeks. Response to a request by Abubakar Talib, nominated member. Is the member in the House? Yes, go ahead.
Thank you, Honorable Speaker. In response to the statement being sought by Honorable Talib regarding continued enforcement of the night to dawn curfew in part of Lamu County, I want, and the member wanted in particular to know, Honorable Speaker, you can kindly protect me from the very probably excited members of
Order, members.
Grasshoppers Party.
Order, members.
So,
go ahead.
The member in particular wanted to know the reason for the continued enforcement of the night to dawn curfew in Lamu despite the court order issued on the 21st May, and a report on the number of individuals arrested or detained in Lamu County during the curfew hours since the court order was issued.
Yes, Honorable McLeod, what's your point of order? Give him the mic. Give the mic to Honorable McLeod. There you are, next to you.
Thank you, Mr. Speaker.
Out of order?
Mr. Speaker, protect her so that we can hear this very important information from the same members who condemn themselves from this side, and in some few minutes, they converge together, Mr. Speaker. Protect her so that we can hear this very important information, Mr. Speaker.
Go on, go. Tongoyo, go on. Go on.
So I will pick from where I left, Honorable Speaker. The member wanted to know the disciplinary and administrative measures being taken against the police officers alleged to have enforced the curfew contrary to the court orders, and the action being taken to ensure compliance with the court order. And I respond as follows. The ministry wishes to clarify the government has not acted in breach of the High Court order issued on the 21st May. And I underline, Honorable Speaker, that which suspended the enforcement of the night to dawn curfew in Lamu and specified areas within the Boni Forest security corridor. The court order only suspended enforcement of the curfew. It did not restrain the National Police Service or other security agencies from undertaking the lawful security operation, including the patrol, intelligence gathering, surveillance, vehicle inspection, identification checks, checkpoints, and other counter-terrorism innovation necessary for the maintenance of the public order and the national security. The security station in such part of Lamu remain a unique and sensitive due to persistent threat posed by the terrorist groups, particularly Al-Shabaab operatives who continue to exploit the geographical characteristic of the area to facilitate movement, recruitment, and the commission of terrorist attacks. Consequently, security agencies have continued to implement intelligence-led and targeted security operations aimed at preventing terrorist activities, disrupting criminal networks, and safeguarding residents, visitors, and critical national infrastructure. These measures are undertaken pursuant to the constitutional and the statutory mandate of the National Police Service to maintain law and order, preserve public safety and security, prevent and deter criminal and protect life and property. The ministry wishes to emphasize that these lawful security interventions do not constitute a curfew, nor do they amount to its reintroduction in any form. Members of the public remain free to move, subject only to reasonable security screening and verification procedures undertaken in the interest of the public safety. Accordingly, Mr. Speaker, the continued establishment of roadblocks and the security screening measures should not be construed as a violation of the court order, but a legitimate policing intervention aimed at countering terrorism and ensuring safety and the security of all persons within the affected areas. Honorable Speaker, regarding the individuals ever arrested or detained, I want to respond as follows. The ministry confirmed that no person has been arrested or detained in relation to the enforcement of the suspended curfew since the court order of the 21st May. On the last part, Honorable Speaker, the ministry confirmed that no police officer has been found to have violated the court order. Officers deployed within the affected areas continue to undertake lawful policing duties under the supervision of their respective commandants and within the scope of law. Accordingly, no disciplinary or administrative action has arisen in relation to the alleged enforcement of the suspended curfew. The ministry confirmed that the Police National Service is fully compliant with the court order and that no curfew is currently in force within Lamu County. I repeat, Honorable Speaker, currently there is no curfew currently in force within Lamu County. And to ensure continued compliance with the court directive, the NPS has undertaken the following measures. I think those are general. I think I've already mentioned those, Honorable Speaker. And the ministry remains fully committed to upholding the rule of law, respecting court decisions, ensuring that all security operations are conducted within constitutional and applicable laws, within protecting the lives, property, security of all residents of Lamu County. Signed by Honorable Kipchumba Murkomen, EGH, Secretary for Internal and National Administration. I submit, Mr. Speaker.
Yes, Taib. Give him the mic.
Yeah, thank you, Honorable Speaker. I find that response from the chairman very misleading, as they still the enforcement of curfew is still in place. So I don't know what answer is giving regarding to there is no curfew in Lamu. Thank you.
Sorry, Taib, can you repeat what you said?
Thank you, Honorable Speaker. What I'm saying is I think Honorable Chairman is misleading this House. There is curfew in place in Lamu. They are all over roadblocks, all the way from Isoe all the way to Mpeketoni. So I really don't understand when he says there is no curfew enforcement and there are no roadblocks on the road to Lamu. Thank you.
Yes. Honorable Member for Garsen.
Thank you, Chair. Mr. Speaker, I think the Chair of Security is misleading. You know that roadblock starts from my constituency. That is an economic sabotage. Chair, to sabotage the people of Lamu and Tana River. So the government has security and machineries. That roadblock should be removed to help the people of Tana River and Lamu, Chair. Mr. Speaker.
Tongoyo. Tongoyo.
Honorable Speaker, I still want to confirm to the House and to the member that as read out, there is no curfew in place in Lamu. And we should not confuse security operations and screening and roadblock to mean curfew, Honorable Speaker. So that is the statement, and that remains so. And I will also want to really call upon my colleagues to appreciate the security situation in Lamu, which has been in a big extent been achieved because of the security checks in place, Honorable Speaker.
Yes, Roida. Order, members. Can you disband these multiple kamkunjis I'm seeing in the House? Order.
Mr. Speaker, tunazungumzia mambo muhimu na hawa watu wa 10 kwa moja wanatusumbua leo, na hii ni mambo muhimu. Wale maskini akipata matako liambata, waambie tuache tuendelee na kazi. Hiyo iliisha na sisi tulipata 10 wao wakapata 1. Tosha, finish. Sasa Mr. Speaker, Lamu wanatuchukulia kama ambao sisi si muhimu, si binadamu. Bwana Speaker, kutoka yule mzungu alipochukuliwa kabla hata ni 2013, sisi Lamu tumekuwa hatuna raha. Tunafungiwa watu, chairman anasema hakuna curfew, lakini barabara ya Bargoni paka Kiunga haipitiki, paka upitishwe na jeshi. Huwezi pita mwenyewe hivi hivi. Watu wa Kiunga kuja Mokoe wanatumia boti. Na usiku mimi napita hiyo barabara, nikizungumza hapa mimi naipitia hiyo barabara. Kukiwa na shida hapa, pengine ni kwa eneo bunge langu na natakikana asubuhi. Lamu imefungwa, hakuna airport, huwezi toka by air, huwezi toka by road. Huwezi toka kwa sababu hata ile airstrip pale airport haina hizi zile zinaitwa runway light. Hata kukiwa na emergency, mtu akipata, kama kuna incident ilitokea, Bwana Speaker, kuna msichana alianguka kule, alikwenda matembezi, ndege ya kumtoa haikupatikana, yule msichana alikufa. Njia ya barabara huwezi pita, wakisema hakuna curfew nini. Mimi mwenyewe kama mbunge paka nipigie simu kama kuna emergency nipewe escort nitoke. Kwa hivyo curfew iko na ni muhimu itolewe. Security is paramount, lakini mmetufungia kwa muda mrefu. Tunaomba jamani, wale security wanaweza fata magari au wanaweza toa time, wakasema time fulani paka time fulani watu wapite, au magari ya mzigo yapite, abiria labda. Lakini haiwezekani mkatufungia hivyo tu, kwani sisi binadamu. Asante.
Point made. Yes, Chairman. Honorable Ngogoyo.
Honorable Speaker, I think I've really exhausted what I had to say.
Just hold on. Member for Garsen, what is the problem?
Thank you, Mr. Speaker. I think this is the House of Information. The Chair for Security has no information on that road. Mr. Speaker, direct the Committee of Security, plus members affected to visit the area. He has no information, total blackout.
Yes, Chairman.
Speaker, I want again to confirm to this House that we don't have active curfew in Lamu. And I personally went with Captain Rueda, and I'm sure she can attest to this. We were in Lamu. There is no curfew, and let's not confuse roadblocks screening with the curfew, Honorable Speaker. And I think the Honorable member who raised this question is already on record before having raised the issue of roadblocks. And we should not confuse roadblocks and curfews. Nevertheless, Honorable Speaker, let me finish, Honorable Speaker. Protect me.
Hold on, time. He's
Honorable
responding
Speaker.
to your own statement, so don't disturb.
Honorable Speaker.
Yes.
The Honorable member was already on record having raised issues on roadblock. You know it was not responded because the minister was supposed to appear before the committee. And Honorable Speaker, I will suggest, I need your guidance. If the members are not satisfied, we have already slotted again the CS to appear before the committee to respond to a number of questions that were not responded to. The Honorable Member Talib is at liberty again to appear and able to make his case before the CS.
Thank you. Yes, Type.
Thank you, Honorable Speaker. The issue of roadblocks in regards to Lamu is totally different from the other issues that I raised about the roadblocks across the country. The curfew is enforced by those roadblocks. Thank you.
Yes, Roida. You are all engaged in a battle of semantics. He is saying there are roadblocks but no curfew. You are saying there's a curfew, and you know in law to have a curfew it must be gazetted. So challenge him by showing him the gazette notice of the curfew.
Okay, ndio mimi nataka kuuliza kama hakuna curfew kuna nini? Manake sisi paka sasa mimi mwenyewe nikienda nakatazwa kupita. Naambiwa sasa kama si curfew ni nini iko hapo? After saa 12 huwezi pita kutoka Mokoe kwenda Gamba hufiki
Gemini Omni Flash is now on Envato, your one place to get the latest AI models for video, images, and audio.
Unaambiwa kuna curfew. Kama si curfew basi ni nini atueleze? What is there? Au ni shida gani? Kuna shida gani mpaka turegeshwe kwa miaka mingi zaidi miaka 15 Speaker? Ni wapi hapa mlipata curfew tu Mungu akatupa ile curfew ya COVID. Watu walilalamika. Sisi miaka 15 sisi tuko kwa curfew tu.
Yes, Chairman.
This is a house of record and we need to be honest to ourselves. The Honorable Rueda, I personally visited Lamu with her. And we managed to transfer almost the entire of Lamu. And Honorable Speaker, I think from the start we must appreciate the security situation in Lamu. And even by extension to this country. What is happening in Lamu are just mere security checks and screenings, which are good for this country, good for Lamu. And I think the Speaker had made it clear. Any curfew has to be enforced by gazette notice, which is not in place. The court order suspended it, and it remains suspended as so. And that is the position, Honorable Speaker. That is the official position.
Right, we can't be flogging the same thing over and over.
Not getting the solution. Speaker, Chair anasema alienda na mimi. Alienda mchana, ulienda na mimi usiku. Sasa mchana hakuna hizo restriction. Sasa acha kudanganya hapa kutudanganya. Tulienda na yeye tukaenda mpaka Basuba, lakini mchana hakuna curfew.
Order, Roida. You are using unparliamentary language. Mwenyekiti hadanganyi. Anatoa taarifa. Type. And I hope you are still not arguing on the difference between curfew and the roadblock.
No, thank you. What I would request, I think, is better placed to get us the information from the ministry in regards to the gazette notice, because this was done over 15 years ago. Thank you.
And in case there is a curfew, it must have a definite period when it is gazetted. So let's go to the next. Doris Donya, is she in the house? Before I invite you, allow me, honorable members, in the public gallery, we have Katumba Comprehensive School. Order, honorable members, take your seats. Order, CNN, take your seats. Allow me to recognize order in the public gallery. We have Katumba Comprehensive School. Order Omongina. You are out of order, Jerusha. Take your seat. I know it's your first day after recess, but you reduce the levels of excitement and exuberance. And I've made very beautiful gardens for you out here. Those of you who want to converse, just go to the gardens, sit, talk, and then come back to the House. I was acknowledging in the public gallery Katumba Comprehensive School, Mwingi Central, Kitui, Olongerin Primary School from Narok West, Narok, Sony Sugar Comprehensive School from Awendo, Migori, and in the Speaker's Gallery, the Skiambere School Complex from Bere North Embu. Then we have St. Hilda Kadonzweni from Mwingi Central, Kitui, and Friends School Kamsinga from Kimili, Bungoma. Honorable members, Friends School Kamsinga is the school where yours truly went to. It is my school and I'm very proud of it. Yes. Yes, Robert Mbui.
Thank you, Mr. Speaker. I want to take this opportunity to also welcome the Friends School Kamsinga and all the other schools to the House of Parliament. Mr. Speaker, you know, a lot of times members here would always tell the students that they should emulate them and maybe try to be like them so that they can come to the House. But Mr. Speaker, I want to say there are greater things that the children can do, our students can do, than even being members of Parliament. They can go on to be great people in the world. So I want to congratulate them and welcome them to the House of Parliament. Mr. Speaker, allow me to also welcome those leaders that came in solidarity with our latest elected member of Parliament, also to welcome them to the House so that they can also see the proceedings. Allow me to also congratulate the newly elected member of Parliament for Olkalau for being elected, you know, in a landslide victory, Mr. Speaker, in such a way that we have shown that Kenyans can make a decision despite anything that anyone does. Even the gas cylinders, even the blankets, even the mattresses, even the boats did not mean anything. He ended up winning, he was called a chokora, and now he's in the House. Mr. Speaker, I want to tell the students, we are also in uniform, in solidarity with Kenyan students. Thank you, Mr. Speaker, for the opportunity.
Thank you. Wangwe.
Thank you, Honorable Speaker. Honorable Speaker, allow me on the onset to welcome all the students, including Friends School Kamusinga. And Honorable Speaker, say that this is the House of Parliament. This is the destination, Honorable Speaker, that most of the students would wish to come there after their training, Honorable Speaker. But Honorable Speaker also insists on this issue of education. The Honorable Speaker, let us focus. We are happy that most of the issues to do with higher education financing, discussion and conversations are going on. Let the Ministry, Honorable Speaker, and the government finalize this issue so that students from Friends School Kamusinga, who must always go to university, Honorable Speaker, can have safe landing and undertake good education in universities, Honorable Speaker, at an affordable rate. Thank you, Honorable Speaker, and I beg to submit.
Thank you. Yes, your request. Honorable members, also in the Speaker's Gallery, allow me to introduce to you a delegation of 9 members of the Kenya Hemophilia Association, led by James Cargo. The delegation is in attendance to follow the proceedings on the report of the Departmental Committee on Health on its consideration of the petition on the management of hemophilia and other bleeding disorders at order number 14. Honorable members, on my behalf and that of the Assembly, I welcome them to the House. Honorable members, you may recall, order, Sirma and your group. Order. You may recall there was a petition here on hemophilia, and I allowed you almost 30 minutes to make very positive comments on it. First, we congratulate the Committee on Health. They have finished looking at that petition and brought the report on record time. It is now listed for debate at order number 14. And the members who brought the petition requested to be invited to the House, and I did accede, and they're sitting in the Speaker's Gallery. You know, hemophilia relates to bleeding disorders. And that being a delicate condition, I'll direct the clerk that once we finish the orders on first readings, we bring forward order number 14.
For just $67, you can generate as many videos as you want and never have to worry about showing your face on camera or using complex editing tools. With only
can also have an opportunity within cases of missing children in Kenya.
Regarding the rising cases of missing children in the country, being sought by the Member of Parliament for Kisii County, Doris Donya. And I want to respond as follows. The number of cases of missing children reported in the country over the last 1 year, including the number of children traced and reunited with their families. Honorable Speaker, there is at least a summarized list of the reported cases of missing children by region, together with the number of children traced and reunited, and I want to quickly go through them. As per January 2025 to June 2026, Nyanza County has got number of reported 47, traced and reunited 42. Central 230, traced and reunited with their families 160. Coast reported cases are 83, traced 57. Rift Valley had 439 cases of missed and traced and reunited with their family 320. Eastern 243, traced 220. Nairobi missed were 54, traced were 12. Western 103, traced and reunited with their families 69. Western 103, traced and reunited were 69. Northeastern 53, traced and reunited with their families were 37. Total number of cases reported of missing children within the said period is 1,251. The traced number within the said period, 917. On the second question, Honorable Speaker, measures being taken by the government, I want to state as follows. The government has taken several measures aimed at preventing children disappearances, improving investigation, and strengthening child protection mechanism in the country. These include establishment and strengthening of the child protection and gender desk at police station to provide child-friendly reporting environment and improve the handling of cases involving children, enhancing surveillance and monitoring along identified trafficking routes, border points, and areas considered vulnerable to the children exploitation and trafficking activities. The interagency collaboration within the county governments, local administration, educational facilities, and civil society organizations in responding to cases involving missing children. Continued use of community policing structures to support earlier reporting, sharing of information regarding missing children within local communities. Public awareness and sensitization program to educate members of the public on children protection, reporting procedures, and preventing of children disappearances. Continued monitoring of emerging threats, including online exploitation, trafficking, trafficking networks, and other forms of child exploitation that may contribute to child disappearances. Honorable Speaker, regarding the confirmation of the existence and effectiveness of child protection rapid response mechanism, the National Police Service, the State Department for Social Protection, the National Council for Children's Services, and other children protection stakeholders have established and operationalized various children protection and rapid responses mechanisms aimed at safeguarding children and responding promptly to cases involving missing, abused, neglected, or exploited children as follows. The Anti-Human Trafficking and Child Protection Unit works in coordination and regional station within Kenya to verify international movement of minors in collaboration is active within Interpol, NCB for children trafficking outside Kenya borders. Specialized children protection units and gender and children desk has been established in police stations across the country to handle cases involving children in child-friendly manner and coordinate rescue and protection interventions. The National Police Service works closely with the Department of Children's Services, county child protection committees, local administration, schools, healthcare facilities, and civil society organizations to facilitate prompt reporting, rescue, tracing, and reunification of the missing children. The members of the public can report cases of the missing person through a toll-free number, Fichua, kwa DCI. Upon receipt of the reports of the missing children, investigative teams are activated to undertake such operation, gather intelligence, disseminate information to relevant agencies, and coordinate rescue efforts whenever necessary. Of course, the arrest and prosecution of the offenders and the existing communication platforms to include media outlets, social media channel, police networks, interagency information sharing mechanisms, and they are utilized to disseminate information on the missing children to seek public assistance in the tracing. Lastly, Honorable Speaker, the policy and the interagency intervention being implemented, the National Police Service, in collaboration with other government agencies and stakeholders, has implemented various policy and interagency intervention aimed at enhancing protection and safety of children in the country. And these include, among the service enforces laws and policy relating to child protection, including the Children Act of 2022, the Counter Trafficking in Person Act 2010, the Data Protection Act of the 2019, the National Child Protection Policy, and other child safeguarding frameworks, investigating offenses committed against children and ensure that the perpetrators are apprehended and prosecuted in accordance with the law. And of course, the multi-agency collaboration that I've already mentioned, Honorable Speaker, and the Department of Children's Services, the National Council for Children's Services, the Judiciary, the Office of the Director of the ODPP, the County Public Protection Committee, international organization and development partners, including UNICEF and the civil society organization. This multi-sectoral approach facilitates coordinated prevention, rescue, investigation, prosecution, rehabilitation, and reintegration of child victims. And Honorable Speaker, establishment and strengthening of specialized unit dealing with the crimes against children to include the human trafficking, child protection unit, cybercrime units mandated to investigate online child exploitation and abuse, and gender and children desk established at all polling stations, as earlier mentioned. And the service has established mechanism for reporting, developing integrated database and information sharing mechanism to support child raising and recovery. I'd also mentioned about the Fichua and DCI. In partnership with the local and international agency, the service has enhanced monitoring and investigation of the online child sexual exploitation and abuse, public awareness campaign on internet safety and responsible digital engagement, collaboration with internet service providers and international law enforcement agency to identify and apprehend offenders. The government continues to undertake community policing initiative and the public sensitization program aimed at creating awareness on the child protection issues, encouraging timely reporting of child abuse, neglect and exploitation, and prompting community responsibility in safeguarding children. Honorable Speaker, the service has leveraged the Nyumba Kumi initiative and the community policing structures to gather intelligence and support early intervention efforts. And the introduction of the TPED for this Nyumba Kumi will continue a long way to really help in this. The service works closely with the Department of Children's Service, health institution, and non-governmental to ensure rescue and the placement of children in safe shelters and provision of medical, psychosocial, and legal support services. I think the rest is support evidence-based policing and resource allocation, improve information sharing and coordination among children protection stakeholders. Honorable Speaker, and this is signed by Honorable Kipchumba Murkomen, EGH, the Cabinet Secretary for Interior National Coordination. I submit, Honorable Speaker.
Donya. Honorable Donya. There is
Thank you, Mr. Speaker. I had raised a concern on the missing children in Kenya. What the chair has given, he has actually stated the organizations which are in charge of the works which go around at the Department of the Police. He has not elaborated on what the organizations are doing. He has just named like 100 organizations. In my statement, I didn't ask for the organizations or those who are in charge. So, Chair, I don't know what was wrong with you giving details on what the ministry is doing regarding the missing children. You have said then you will ask the Nyumba Kumi to do their work. We know the Nyumba Kumi are there. So you are just evading the responsibility as chair and the ministry in charge of this to take care of our children. Mr. Speaker, I didn't ask for the long list of the organizations. I just wanted to know the measures they are taking to ensure that our children have safety and their security is guaranteed. Thank you, Mr. Speaker.
Yes, Chairman.
Yeah, Honorable
Let's
Speaker.
take one more, Chairman.
Yeah.
Mama Zamzam.
Asante sana Mheshimiwa Spika, na mimi niweze kumuunga mkono dadangu Donya. Watoto wengi wanapotea Mheshimiwa Spika, na sio sawa wala si haki mwenyekiti kusema kuwa waweze kuwapatia wazee wa mitaa. Wazee wa mitaa hawawezi kuwa na ile machinery ambayo inafaa zaidi kujua watoto wanapotea namna gani, na hata wengi utapata wanavushwa boda Mheshimiwa Spika, wazee wa mitaa hawako kule.
My work is easy because I use ClickUp. Here's how I keep track of all my tasks. I start by brain dumping everything I need to get done in a list view. Next, I set a priority and a due date to keep things on track. I create custom statuses to organize my progress exactly how I want it. I like to add the action items field so AI can show me the next steps. I add my teammates as watchers so they're in the loop. ClickUp makes work easy, from personal projects to running a multi-billion-dollar company. Click the link below to create your workspace for free.
Speaker, also allow me to weigh in on this matter. And I, coming from the border point, the issue of disappearance of children is becoming an alarming issue. While we have done a lot of work with the local administration and the schools and everybody else, we still believe the national government should do much, much more to protect an innocent child. Many of the cases, Honorable Speaker, the children are lured on their way from school in the mornings or in the evening or just over the weekends or over school holidays. So we just want to urge the government to go out of its way to enhance public civic education and continuously remind parents it's their sole responsibility to take care of their children. Thank you, Honorable Speaker.
Yes, Tongoyo.
Thank you, Honorable Speaker. I respectfully also with the views of the members, but Honorable Speaker, referring to the statement, I think it was very clear. The first question is no dispute. It was enumerating the number of cases. I think that is, we have well done, and creatively they are quite alarming. On the second, Honorable Speaker, it was about the measures being taken to investigate, to curb the abductions. The other was in regards to confirmation of existence of effectiveness. Honorable Speaker, I think we tried to, the issue of protection of children involve both the government and non-government actors, to include the parents, NGOs, and even international actors. And that is, Honorable Speaker, the extent that the statement tried to go to explain the broader interventions to curb the vice. So, Honorable Speaker, I'm also really disturbed by the numbers, but the issue of enumerating the players is part of what the question sought to address.
Next is Honorable Mwango in the House. Yes, Chair Transport. Are you ready with the response?
Yes, I am.
Go ahead.
Thank you, Honorable Speaker. Honorable Speaker, on Thursday, 2nd July 2026, the member for Starehe constituency, the Honorable Amos Mwago, requested for a statement from the chairperson of the Departmental Committee on Transport and Infrastructure regarding the implementation of the instant fines system. The Honorable Mwago in the statement indicated concerns regarding the operationalization of the instant fine system, including the adequacy of road signage, public sensitization, system safeguards, and plans for nationwide coverage. Honorable Speaker, the Honorable Mwago therefore sought to, among other things, establish evidence that clear and visible speed limits and other traffic signages have been placed and motorists adequately sensitized on the operationalization of the system, and B, plans to ensure other road sections across the country are covered under the automated instant fine system, and C, system safeguards put in place to guarantee the accuracy and integrity of the instant fine system. Honorable Speaker, the committee received a written response from the Ministry of Roads and Transport, which I now wish to make. One, regarding evidence that clear and visible speed limits and other traffic signages have been placed and motorists adequately sensitized on the operationalization of the system, the ministry submitted that the road sections where speed cameras are currently being deployed are fitted with the requisite statutory speed limit signs. The ministry acknowledges that the availability and condition of traffic signs across parts of the national road network remain inadequate, and some signs have been vandalized, damaged, obscured, or removed over time. To address this, NTSA is engaging with Kenha, Kera, Kura, and other relevant road authorities to progressively install additional speed limit signs and advanced warning signage informing motorists that their speed is being monitored. Further, NTSA, through the Department of Road Safety Audit, is undertaking joint road safety audits and corridor assessments with the relevant road authorities to identify locations requiring additional or replacement traffic signs. Regarding plans to ensure other road sections across the country are covered under the automated instant fine systems, the ministry submitted that the National Road Safety Action Plan provides for a phased implementation strategy based on risk assessment rather than nationwide deployment at inception. The implementation program includes identification of high-risk corridors and urban areas using crash statistics and other safety data, progressive deployment of automatic speed enforcement demonstration projects or designated high-risk road sections, expansion of automated enforcement and compliance systems to additional road corridor based on operational experience and road safety priorities. Capacity building for enforcement and agencies to ensure standardized and technology-driven enforcement and continuous integration of enforcement systems with the road safety databases and monitoring systems to support evidence-based expansion of the program. And Honorable Speaker, regarding system safeguards put in place to guarantee the accuracy and integrity of instant fine systems, the ministry submitted that NTSA has established comprehensive legal, operational, and technological safeguards, including standardized operational procedures governing detection of offenses, verification of offender identity, issuance of notifications, electronic payments, handling of disputed offenses, data management, monitoring and reporting, technology-based evidence using certified speed detection devices, mobile surveillance systems, and approved digital enforcement platforms. Verification before notification to confirm driver or registered owner identity. Right to fair administrative action, affording motorists an opportunity to admit liability and settle the prescribed administrative penalty, or dispute the notification through the legally established adjudication process. Cashless payments processed electronically through designated government payment platforms. Anti-corruption controls, including prohibition of cash handling, digital recording of all enforcement actions, regular audits. Mechanisms and continuous system oversight, and continuous monitoring and performance evaluation through the governance framework established under the National Road Safety Action Plan, including quarterly performance reviews, annual reporting, key performance indicators, and continuous evaluation of enforcement. And lastly, Honorable Speaker, the ministry further submitted that the implementation of the instant fines system is contingent upon the decriminalization of minor traffic offenses currently provided for under Section 117 of the Traffic Act. And to facilitate this reform, the authority is developing a Traffic Amendment Bill 2026 to establish an administrative enforcement framework for minor traffic infractions. The proposed amendments replace criminal prosecution with an administrative process under which traffic infraction notices may be issued electronically. Offenders may admit liability and pay the prescribed administrative penalty, or exercise their right to administrative review and appeal where the notice is disputed. I submit. Thank you, Honorable Speaker.
Thank you, Honorable Mango. Before you seek clarification, allow me to acknowledge in the Speaker's Gallery, Ronjena Secondary School from Narok West, Narok. Students, when you are mentioned, you stand up to be acknowledged. There is also Mary Mother Academy from Kieni, Nyeri. There is Ikawa School from Chuka, Igambangombe, Tharakanithi. And in this public gallery, we have Arena Comprehensive School from Kisumu, Central Kisumu. And Cheptikit Academy from Mount Elgon, Bungoma. On my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to the House of Parliament. Mwango?
Thank you, Mr. Speaker, sir. Even as I seek clarity, allow me to join fellow Kenyans of goodwill to welcome our latest Member of Parliament from Olkalau constituency, Sami Douglas Kamau, who I campaigned vigorously for. He was called a Chokora, but is now in the precincts of Parliament. Mr. Speaker, I wish to seek clarity from the Chairman Transport. I just ask a very basic question. Evidence that there are clear signages along the highways where they put the cameras, where they are enacting this automated fine system. It is clear that from his response, he's admitted that most of the signages have been vandalized. Others are not clearly visible. Others are not there. My question was very simple. How do you have cameras in a place where there are no signages? It is very unfair to find a person where there are no signages, but the cameras are operating. And the other question was, how are they sensitizing the people or motorists about this new system? I did not get an answer to that. I just had a a very long story, a very ambiguous story around the whole thing, without coming out clearly. What are the measures put in place to sensitize many motorists? And what are they going to, how are they going to address the issue of the signages? Where there are no signages, how do you find a person where there are no signages? On the other issue of the integrity of the system, you can see there's a very big disparity in matters how these fines are, maybe these are applied. For example, you'll see a motorist fined 500, another one fined over 10,000, another 3,000. It is not standardized as he claims to, as he claims. So I'm not satisfied with this answer.
Thank you. Let's take one more. Kimani of Molo.
Thank you, Mr. Speaker. Mr. Speaker, I would like to remind you, Honorable Speaker, that you did guide that the Committee of Finance will be enjoined in this particular matter for this reason.
Yes.
That I raised the floor of this House. The punishment that should be done, the offense is not committed by the owner of the vehicle. It is committed by the driver. And I give a scenario. Take, for example, all the secured loans by banks, for example. So a bank, like Equity Bank, will have maybe 100,000 motor vehicles on the road that are registered in the name of Equity Bank. So therefore, if those fines are now levied on the logbook of those vehicles, then it's the Equity Bank that will pay those particular fines. Take, for example, someone who owns a fleet of Nissans or buses. I own 100 buses that commute between Rironi and Mount Summit, and every day there is probably a new driver. Then those fines will come to the logbook of those vehicles which I'm registered under. A more even practical example, think about our boda sector. 90% of the bodas that you find on the roads are not owned by the cyclists. They are owned by lending companies like Mogo, like Watu, like Mkopa. And therefore, when these fines then are levied on those lenders, because they're the ones who register those logbook, then those businesses will certainly close down. I think it's very important, Honorable Speaker, that this matter be re-examined and to find a way of levying the fine on the person who commits the crime, who is the driver, and not the owner of the vehicle, Honorable Speaker. Otherwise, Honorable Speaker, the vehicle that you have, that you use in the village, that is someone who carries maybe your mother or your father from one place to the other, they keep committing fines, and you keep seeing fines of 10,000 shillings every day on your phone. In a month, 300,000 shillings. It is not. It is not. You
made your point. Yes, Robert Bowie.
Yeah, thank you, Mr. Speaker. Mr. Speaker, you know, I'm a supporter of cameras on the roads because I think Kenya needs discipline on the roads. It's a very important thing because when you travel the world, you notice that people are very, very careful when they see the camera signs. And then you notice that accidents are much less than they are here. So it's a very good idea. But Mr. Speaker, even as we support it, I can see the concerns many members have. And I have also another concern. On Langata Road, Mr. Speaker, there's a camera. I don't know where exactly. But I have been a victim, and I know a few people who have been victims of the same. But sometimes you ask yourself, why would the camera be put in a place where there's no school next door, there's no place where people are walking on the road? It's basically a highway. Why would you put a camera there and put a speed limit in, Mr. Speaker, of 50 kilometers per hour? A place where if you move at 50 kilometers per hour, you're actually likely to cause an accident. So, Mr. Speaker, I think there is need for this to be sorted out and thought through before we actually implement it fully.
Mr. Speaker, I thank you, and I also must thank my neighbor, the Honorable Amos Mwago, for bringing this to Parliament. And maybe it would be informative for the chairperson of the Transport Committee to also do a search and spin and see the need is appreciated. The need for cameras and surveillance on our roads is more than appreciated. However, Mr. Speaker, if you travel on the roads in Kenya today, you are never able to tell where the speed limit zones are. There is never a sign that shows you that the 110 speed limit starts here and this is where it ends. Secondly, Mr. Speaker, There
With deep freeze, exercise is not a punishment, but
TSA to ensure that when a charge is made, it is not occasioned on the owner of the vehicle. It is actually a charge that is put on the driver who was driving at the moment when the offense was done. So, Mr. Speaker, I do believe there is space for the Transport Committee to go back and examine the matter that Honorable Mwago brought to us and find how the technology will also work with the real life situation on the roads, and especially if they're digitizing the penalty system, that must also have real what you would call highway furniture, real road furniture, up to and including the traffic signs, Mr. Speaker. I do thank you.
Carola Mondi.
Thank you very much, Right Honourable Speaker. I think on the issue raised by the Chair of Finance Committee that liability should just be limited to the driver, legally may not be sound. I think we are familiar with the concept of vicarious or imputed liability, where the person held liable is a person who has what we call in law respondeat superior legal control of whatever has caused the accident, like motor vehicles or employees, employers. So it may not be very practical, and risks are normally allocated to those who can handle them best. So the reason why it will be the financier or whoever is registered.
Carola Monde, I thought there are graduated levels of responsibility. Speeding is personal responsibility to the driver. Allowing a defective motor vehicle to be driven by your driver, then you take vicarious responsibility. I thought that is, those are the graduated situations in the law.
Correct.
Isn't that so?
Correct.
So Kimani is half right, you are half right. So you can...
No, I don't. I just wanted to raise it so that we don't mislead the nation that there's no, that there's liability.
There is vicarious responsibility.
Yeah, vicarious liability or imputed liability, as it is called. Thank you.
Yes, Mkunji.
Thank you. Thank you, Honourable Speaker. I also rise to agree with the sentiment shared by my colleagues. Honourable Speaker, I'm an often user of Thika Road, and that is where these cameras have been concentrated. And Honourable Speaker, I believe the whole process of establishing these cameras must be a process that involves this House and involves the public keenly. Because, Honourable Speaker, one day while I was coming from up country, around 8 p.m., I found cars slowing down seriously, below 50 kilometers per hour, Honourable Speaker. And I was actually wondering what is going on. Only for my driver to receive a message the next day to pay 10,000 Kenyan shillings, Honourable Speaker. And I would say that we need to agree that technology is the way to go when it comes to enforcement of our laws. But, Honourable Speaker, this is a process that must be keenly implemented and its procurement and establishment highly publicized so that, Honourable Speaker, we don't have tribes of the public getting into even accident just because, Honourable Speaker, there is establishment of technology. Thank you, Honourable Speaker.
Oundo.
Speaker, I didn't go to the law school, but I know there's a principle that, honestly speaking, will end up this arrangement punishing motor vehicle owners more than punishing those who commit the offense. As you clearly say, speeding is a human endeavor. Might not necessarily be a mechanical problem, but it's a human endeavor. And I want to give a very interesting case. Some years back, I was charged in Nakuru court for speeding. So when I went to the magistrate, being what I could do, I asked the prosecutor that who was driving the vehicle at the time you caught on the camera speeding. They say they did not know because the camera was unable to pick out the driver. And the magistrate agreed with me that the prosecutors on a fishing expedition was left scot-free. I fear that this is going to happen. And then, Honorable Speaker, a fine is a penalty for breaking the law. If you are purported to have broken the law, if you are not given a chance to mitigate so that appropriate punishment is meted out, would it not be unconstitutional to punish me unheard?
It is not. Read the law. There are what we call instant fines in petty offenses that the offender need not go to court. Those are called misdemeanors in law.
Honorable Speaker, for example...
You are the lawmaker.
Yeah. For example, Honorable Speaker, let's just look at a practical case. An ambulance speeding to take somebody to hospital. How would you treat the matter? On the other hand, I'm carrying an expectant lady who is just about to do it. I don't know what to do it. I have to speed. So I need a chance to mitigate.
All those exceptions are there in law.
Yeah. So that's why we are saying this process, the way it is designed, is going to be extremely punitive and unfair to the people of Kenya, notwithstanding the fact that we need to enforce discipline on our roads. The amount of accidents we are having, the injuries that we are having can be avoided. But we need to find a more friendly and more people-focused approach to ensure that we deal with this malice once and for all. Thank you, Honorable Speaker.
Yes, GK, can you, Mama Zamzam? Hold on, GK.
Asante Mheshimiwa Spika. Mimi nashangaa nikiona viongozi wanatetea ile fine ya instant ambayo madereba ambao hawana uangalifu ndani ya barabara wanapewa. Mheshimiwa Spika, tumepoteza maisha mengi sana. Juzi na jana tumekuwa kwenye michezo kule Rwanda. Dereva hata ukimwambia nimechelewa mpira na kuambia hapana, kuna cameras, nikienda vibaya mimi ndio nitapigwa fine, watoto wangu watakosa chakula. Kwa hiyo Mheshimiwa Spika, sheria ni sheria, ukata mbele na nyuma, hamna cha hii wala hii. Na kisha nimesikia ndugu yangu mmoja akisema amempongeza mwenzake na akasema aliitwa chokora. Mheshimiwa Spika, wengine huwa na ile feeling, lakini mimi nataka kuambia hata Kasongo ambao wanamuita rais wetu ni Wathog. Kwa hiyo wao wakianza kuita watu majina, wewe tayari na wao pia kuitwa majina, wakae watulie. Lakini nikirudi kwa barabara lazima tuwe waangalifu, na hili ni jumba la kutunga sheria, lazima tuangalie sheria ambayo inaweza ikamkinga Mkenya kutokana na ajali za barabara. Asante sana Mheshimiwa Spika.
Yes, GK.
Thank you, Honorable Speaker. Honorable Speaker, the matter raised by members needs a bit of engagement with the ministry, but we need to ask ourselves what has occasioned this kind of intervention. Honorable Speaker, we are losing on average 5,000 lives every year. And this is not something that we can take lightly. We are here expressing anger over the use of technology, knowing very well, honorable members, that the use of technology is the best international practice all over the world. The use of technology replaces the roadblocks and the use of police officers on our road. Honorable Speaker,
yes, what's the point of order? Is it point of order?
It can feel like the end of the world when you don't have the right video assets. So that's why I use Envato.
That's okay, Honorable Speaker.
Mr. Speaker, I must inform the Honorable Chair for Transport that members are not against any enforcement of any traffic rules. And in fact, we as members are part of forming the laws that govern traffic in this country. However, Mr. Speaker, the chairperson is not in order to refer to international practice, because what is occasioning traffic zones in Kenya is places where government has not been able to put infrastructure up to and including overhead crossing bridges. So we find ourselves in a situation where an international highway, where standard speed would be around 110 kilometers, is reduced to 50 kilometers per hour, giving a perfect example of Mackenzie, near Thika, just past Thika at Del Monte, on an international highway, the Great North Road, limited to 50 kilometers per hour, Mr. Speaker, without any road sign showing where the speed limit zone starts and where it ends. So, Mr. Speaker, this parliament is not against international standards and international practice in traffic. It is to tidy up that the laws that leave parliament are implemented in a way that is not offensive to the users of these roads, Mr. Speaker. I thank you.
Do you want to be informed again by Member for Molo?
That's okay, Honorable Speaker. It's okay. But Honorable KJ was not informing. I think he did something different.
He was debating.
He was debating. I hope.
Thank you, Honorable Speaker. Honorable Speaker, the chair did say that we are angered by use of technology. And I find offense in those words. What we are saying, Honorable Speaker, and you rightly put, where the mistake has been committed by the owner of the vehicle, let the fine be on the owner of the vehicle. Where the offense has been committed by the driver, let the fine be on the driver. And I think the chair should take that very, very seriously, because that is going to be a very big decision to make, and especially as I outline the businesses that will affect, especially the banking and all those financial sector institutions, Honorable Speaker.
Go on, GK. You've now been informed.
Honorable Speaker, before I get to, I respond to Honorable Member for Moro, let me address the issue raised by Honorable Mokonji about this matter having been debated in this House. Honorable Speaker, this law permitting the ministry to use technology was passed here in Parliament. And we all debated and agreed that the use of technology is the best way forward to address the many deaths that we are experiencing on our roads. We have had many special motions in this House.
Chairman, if you listen carefully, there are just about 2-3 categories of concerns. Number one is that the speed cameras you put on the highways must be visible and must be relevant to the situation. So there is not a continuous speed limit on the highway. There are speed limits where there is need for extra caution and care. That's what I've picked from your colleagues. Number two is the point raised by Kimana and Karole Omondi. When do you apportion personal responsibility to a driver and vicarious responsibility to the owner of the vehicle? That is the second point. The third point raised by several members is that having passed the law is not enough. You must continue with public awareness and public education, given what you are saying, the unacceptable number of people who are losing on the roads. So if I was in your place, which I'm not, you should be addressing those 3 points.
Well guided, Honorable Speaker.
Yes, Mukunji, what is it?
For this law to work for the people of Kenya, Honorable Speaker, we should have at least 3 months of continuous information on phones so that people can know.
That is methodology. Let him answer.
Thank
That's
you.
methodology. The principle is the same.
Honorable Speaker, I don't want to overdwell on Honorable Mukunji's point, but the ministry indeed engaged in that exercise, and it was actually more than 3 months. I remember they started sending messages to us to alert us that the use of instant fines through technology would be employed, which is what is happening. Honorable Speaker, when you think of a busy road like Thika Highway, where at some point where KJ has mentioned Mackenzie Mackenzie. 50 kilometers per hour is very punitive. It is not even possible to drive at that speed. It causes a traffic snarl-up, which is inconveniencing motorists. And that is something I have personally raised with the Ministry and NTSA agency. Honorable Speaker, the gaps that are that have been identified by members are being addressed by the Ministry. And I will follow up, Honorable Speaker, together with my committee to ensure that these concerns are well addressed. Honorable Member for Molo, I am sure the issue that you have raised needs to be interrogated, needs to be checked so that we see who is supposed to carry the blame. Is it the owner or is it the lender, or is it the borrower? Is it the driver or is it the owner? I personally have had issues with my drivers when they engage in, when they are fined, when I'm fined on offenses that are caused not by myself. And it's something that needs to be checked. Honorable Speaker, if you allow me, I will again go back to the Ministry and ask them to address these very important concerns. Thank you, Honorable Speaker.
Thank you, honorable members. In the Speaker's Gallery, I acknowledge Starehe Boys Center from Starehe constituency, Nairobi. Chemase School from Tinderet, Nandi. In the public gallery, we have Kariobangi North Primary School from Embakasi North, Nairobi. Kiriko Junior from Kinangop, Nyandarua. Kiplongon Primary School from Eldama Ravine, Baringo. And Pine View Academy from Eldama Ravine, Baringo. Honorable members, on my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to the House of Parliament. That ends statement hour. We now call the next order. Clerk.
Order number 8, the Trade Description Amendment Bill, National Assembly Bill number 42 of 2026, first reading. A bill for an act of Parliament to amend the Trade Description Act and for connected purposes.
Next.
Order number 9, the Legal Metrology Bill, National Assembly Bill number 43 of 2026, first reading. A bill for an act of Parliament to make provisions for the manufacture, sale and use of weighing or measuring equipment in trade, health, safety, law enforcement, environmental protection and sale of goods and for connected purposes. Order number 10, the Kenya Economic Zones Bill, National Assembly Bill number 46 of 2026, first reading. A bill for an act of Parliament to provide for the establishment and declare
kote nchini mbele tuendelee mbele Kenya tuende mbele
Kenya tuende mbele. NCBA, go for it.
Thank you, Mr. Speaker, for this opportunity to report on this petition. Honourable Speaker, I beg to move that this House adopts the report of the Departmental Committee on Health, a report on public petition number 001 of 2026 on the management of hemophilia and other bleeding disorders in Kenya, laid on the table of the House on Tuesday, 23rd of June 2026. Honorable Speaker, public petition number 021 of 2025 was submitted by Mr. James Cargo, Treasurer of Hemophilia Association of Kenya, on behalf of hemophilia patients across the country and was tabled in the National Assembly on the 8th of March 2026. The petition was referred to the Departmental Committee on Health for for consideration. Mr. Speaker, the petition highlights the significant burden of hemophilia in Kenya. Mr. Speaker, Madam Speaker, hemophilia is a bleeding disorder that affects the clotting ability of blood in the body, such that patients who are affected bleed excessively, are unable, their blood is unable to clot, and they bleed in organs, often the knees, sometimes in the brain and internal organs, causing severe damage to joints and many times causing death. It often affects male children, male persons, because it is sex-linked. Madam Speaker, it affects an estimated 4,000 to 4,500 to 5,500 Kenyans, yet only about 1,300, about 23% have been formally diagnosed, meaning, Madam Speaker, that a lot of people suffer and some even die. Madam Speaker, this is a disease that is challenging in treatment because I've said many are not diagnosed. It is expensive to treat, and the treatment centers are few in the country, and it's also extremely expensive to manage. Currently, it is through donor support that most people get management and care through the World Federation of Hemophilia, and the support they give is valued at about US $20 million. That is almost 2.6 billion annually. Even this contribution still covers only about 30% of what is required to buy just the clotting factors, leave alone the other support that is needed. And worse still, Madam Speaker, the memorandum of understanding governing this support is actually expiring early next year. So without urgent domestic financing and sustainable supply, Kenya faces a preventable human crisis that will leave thousands of patients without this life-sustaining treatment. Madam Speaker, hemophilia treatment, expensive as it is not covered in our current Social Health Authority benefit packages. And Madam Speaker, this is a very expensive treatment. One dose of the drug that is used, which is a factor concentrate, actually costs 50,000 shillings. And in most patients in a year, about 1 million shillings. Not many Kenyans can afford this. And yet it's not covered as I've indicated. This level of expenditure is burdensome and catastrophic for most families with hemophilia patients. The National Health Insurer needs to make provision for hemophilia treatment so as to ease the burden of families of persons living with hemophilia. The petitioners therefore prayed, Madam Speaker, for the committee to effect the following. 1, recognition of clotting factor concentrates as essential medicine for both adult and pediatric hemophilia patients' treatment to ensure their consistent and sustainable availability in Kenya. 2, that the government strengthen infrastructure and capacity by establishing additional hemophilia treatment centers across the country to enhance diagnostic capacity, improve healthcare worker training, including specialized pediatric care, reviewing medical curricula in school to incorporate management of hemophilia and other bleeding disorders, and increasing funding for public awareness, particularly in relation to early childhood screening. Madam Speaker, as it is now, we have just about 15 centers in the country that can look after these patients, and some just give supportive treatment. Effective treatment is only in Kenyatta National Hospital and Moi Referral. So you can see how many how many people are suffering to get services when they have this problem. The petitioners are also asking us that there's need for formal recognition of hemophilia as a disabling condition to enable registration with the National Council of Persons with Disabilities, as well as inclusion of hemophilia treatment under the Social Health Insurance Fund. 4, any other measures that the National Assembly deems appropriate to address the plight of persons living with hemophilia. Madam Speaker, the committee considered this petition and met with the petitioners, the cabinet secretary, and 3 patients that are affected and other stakeholders. And after several very serious considerations, Madam Speaker, the committee made the following recommendations, and these are really the most important. That the Cabinet Secretary, Minister of Health, includes clotting factor concentrates, that is what we use for treating them, covering both adult and pediatric formulations as essential medicines in the Kenya Essential Medicines List, which will then make it part of our regular treatment armamentarium. That the Minister of Health, the Kenya Medical Supplies Authority, and county governments ensures sustainable procurement and consistent distribution and availability of the factors within the national supply chain, including through pooled procurement arrangements with local and regional and international agencies, because often these are not available locally. So working with international agencies is important. That the Cabinet Secretary, Minister of Health, and the Social Health Authority, and the Benefits Package and Tariff Advisory Panel to develop comprehensive hemophilia benefits package under the Primary Health Care Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund that will make provision for clotting factor infusions, specialist consultations, hospital admissions, physiotherapy, diagnosis, and screening, as well as psychological support. Screening is particularly important because diagnosed early, these patients can actually be supported and avoid disabilities and even death. That the Minister of Health and the National Board for Social Protection recognizes hemophilia patients and their caregivers as vulnerable persons and affords them the necessary social assistance and social care pursuant to the Social Protection Act number 12 of 2025. Madam Speaker, it is important that these patients with this chronic illness, often debilitating, benefit from social protection just like other people. That the Minister of Health, in collaboration with the National Council for Persons with Disabilities, classifies hemophilia as a disabling condition to afford hemophilia patients access to benefits and protection available to all persons living with disabilities, including tax waivers for adults, even support with assistive devices. That the Minister of Health, in collaboration with the county government, established additional fully fledged hemophilia treatment centers with trained clinical staff, diagnosis capacity, and reliable access to clotting factor concentrate, which is key in their management. That the Minister of Health, Minister of Education, Healthcare Professional Statutory Bodies, and Kenya Medical College incorporates hemophilia management in the clinical training and education curriculum. Madam, we actually noted that many health professionals come out and actually are not clear and cannot make early diagnosis, endangering the lives of people, particularly at first contact, when it is most useful to make a diagnosis. And also continued care in this specialized area. that the Ministry of Health and county governments regularly train community health promoters and community health officers and assistants on early identification and referral of bleeding disorders. Community health officers and community health promoters is a new cadre, and most of them actually do not have adequate training in this area. So this is important. That the Digital Health Agency introduces a national hemophilia.
The Voto's acne removal, effortless precision with a simple slider. Navigate to blemish removal and select freckles acne. Use the sub-slider to seamlessly remove acne from your photos. Experience a 10x faster editing workflow with the Voto for professional photographers. Voto, the most efficient AI photo editor.
Budget provisions. That the Ministry of Health undertakes national awareness on bleeding disorders, including hemophilia. It is important, Madam Speaker, that people know about this, and so the ministry needs to actually roll out training so that people are aware of what happens. Very, very few people know about this, and sometimes people even go into minor surgeries and actually suffer severely. That if they were aware, they would know that they cannot undertake such minor surgeries. Honorable Speaker, in the light of the recommendations by the Departmental Committee on Health on its report on public petitions number 001 of 2026 on the management of hemophilia and other bleeding disorders in Kenya, I beg to move and urge this House to adopt this report. And I really ask members to support this. As a committee ourselves, Madam Speaker, we noted that the National Transfusion Center that deals with blood is not properly financed. And we were a little bit surprised at the low level of financing of 300 million shillings per year. We decided in this budget to double it, but even that is far from adequate. The committee is committed that we'll actually lobby for more financing for this disease condition. Therefore, Honorable Speaker, I beg to move and ask Honorable Lenguris to second.
Yes, proceed. Thank you, Madam Speaker, for this chance to support this report on management of hemophilia and other bleeding disease disorders in Kenya. Madam Speaker, from the report from the Committee of Health, we can hear that this is a very fatal disease, Madam Speaker, that is life-threatening. Madam Speaker, this is a disease that's characterized by severe bleeding that comes at any time. We have also heard from the report, Madam Speaker, that we have a big challenge in the country in the management of this disease. This is a disease that needs very urgent treatment when it comes. And from the report, Madam Speaker, we can identify that there are also challenges in the treatment centers in the country. So, Madam Speaker, I want to support this report and request the ministry to put strategies in place to ensure that patients with this kind of disease also get treatment like any other patient in the country. Also to ensure that access of treatment and also improving or increasing the treatment sites in the country is one of the most urgent things that the ministry will need to do. I want to appreciate the work that has been done by the committee because, Madam Speaker, we have identified that there is a big gap on access of treatment by these patients who are suffering from hemophilia. And this is a fatal disease which is also characterized by a lot of high mortality rate. Because if these patients are not managed well, it is a condition that can kill very fast or very easily. So I will urge the Ministry of Health to follow the recommendations, the outlined recommendations by the committee, this committee, to be able to establish centers that can take care of these patients. We have also gone into ensuring that recommending to the SHA to ensure that this is one of the conditions that we support under the SHA coverage, so that they also benefit, because it is a very expensive disease, and if you don't support them, Madam Speaker, our patients will be suffering. So I want to support this report and urge the ministry to give a lot of attention to the recommendations that have been set aside by the committee to ensure that we serve these patients with a lot of care, with a lot of urgency, and ensure that even the centers are increased in the country so that patients can access, because at the current, there are only 2 treatment centers in the country. So patients, you can imagine all over the country, patients clocking up or crowding in the 2 facilities. So this is one of the things that we need to give attention and also support with the budgetary, so that they can, our patients can get support, and also get any other support that they can get from other relevant government ministries. Thank you, Madam Speaker, and I support the report. Thank you.
I second.
I said already, I second.
Honourable members, I now propose the question that this House adopts the report of the Departmental Committee on Health on its consideration of the public petition number 01 of 2026 and regarding the management of hemophilia and other bleeding disorders among the patients and children in the country, laid on the table of this House on Tuesday, 23rd June 2026. Honourable members, before I open it for debate, allow me to recognize the presence of Eldoret Achiever School from Kapseret constituency, Uasin Gishu County, who are seated in the public gallery. On my own behalf and that of the substantive speaker and the rest of the National Assembly, we wish to welcome Eldoret Achiever School to the proceedings of Parliament. Karibuni sana. Honourable Pukose.
Thank you, Honourable Speaker. And I know that the Eldoret Achievers are now seeing their women rep as the Deputy Speaker in the House. I hope that they are very proud of you. Honourable Speaker, I stand to second this important report by the Committee on Health, which I'm a member. Honourable Speaker, hemophilia, for those who don't understand, is a genetic inherited disease that affects mainly male, and women are the carriers. So you find that this is a bleeding disorder. There is failure of the clotting factors to, once somebody is injured or gets a cut, those clotting factors, there are 2 types. You are talking of type A and type B. And you have clotting factor 8 and clotting factor 9, which makes when you are cut, you find that your blood can now be able to clot. So that factor is missing in the inheritance. And once it misses, then when you get cut, you will find that these people bleed. They bleed seriously. And at times, Honourable Speaker, you will find that maybe a boy is taken for circumcision without people knowing. And once he's circumcised, you will find that this child will bleed to death or even gets injured. You will find that the hemophilias are exposed. They might even just be traumatized. Through trauma, they get injured, maybe any part of the body, and the bleeding is that serious. So, Honourable Speaker, normally in the hospital we have trained hematologists who handle them. And you'll find that these trained hematologists give them the factor concentrates. This is what is missing in their blood, so that their blood can be able to clot. And these factor concentrates, they are not available locally.
You see those payments you make regularly, maybe to your landlord, your suppliers, every day, every week, every month? You can automate them with OpenFloat.
Schedule your regular business payments so your bills are paid automatically in time, every time, with OpenFloat.
Through donor funding. And this donor funding has been supporting by purchasing these factor concentrates. And therefore, once the donor funding is now going to stop, then you have these Kenyans exposed. You have these Kenyans not having factor concentrates. You have these Kenyans not able to, Honorable Speaker, they are not able to import that factor concentrate. You'll find that it's the donors the donors who are importing them and supplying to various facilities. Kenyatta National Hospital, Department of Hematology under Professor Mwanda is the one which has been supporting them, and other hematologists throughout the country. So you'll find that, Honorable Speaker, once the factor concentrates are not imported, then these Kenyans are exposed. It means once they get a cut, there is nobody who will be able to assist them. You will find that these factor concentrates are given on regular basis, maybe twice or even 3 times in a week. And as Honorable Nyikal put it, one bottle of the factor concentrate is costing 50,000. So you can imagine 50,000 times 2 times 3, that is around 150,000 per week. Times 4, you'll find that you are talking of an enormous figure which they cannot be able to afford. So what we are asking the ministry is, as per the recommendations which we made, can we have it under SHA? Can we have it also being part and parcel of our medical system so that when you go to KEMSA, it's available and it's be able to be supplied to those centers where we are able to treat cases of hemophilia. With those few remarks, Honorable Speaker, I want to support the recommendations of the committees and hope that the Ministry of Health will be able to act on them. Thank you, Honorable Speaker.
The Honorable Martin Owino, Member for Ndiwa.
Thank you, Madam Speaker. As a member of the Health Committee, I also stand to support this report. And thank also James Cargo and the hemophilia team for petitioning the Parliament to take consideration of this life-reducing disease. Madam Speaker, it's not a matter of cost. Anything that hurts Kenya should be addressed. And it's no good also to say that only donors can address. If donors can come and address issues of our own people, how about ourselves? When one bleeds, family bleeds, and all of us bleeds. So as the chair said, we need first of all to recognize these clotting factors concentrate into our medicine essential kits so that they can be brought together with primary health care medicine. Madam Speaker, access is the issue here for those who are suffering from this ailment. Access in time of facility operations and also access in terms of distance and access to the medicine themselves. As it was said, only 15 facilities are available. I think, Chair, we need to increase this to at least 47 facilities so that we have at least one facility in a county providing this treatment to the people. As far as inclusion in SHA benefit, I think this time, and I thank the President for this, we put a lot of money in primary health care. We should address this. Because there is no prevention, this is hereditary. There is a lot of treatment required, as a member has said here, sometimes 2-3 times a week. And what that does is only through prophylactic care, replacing all those missing clotting concentrates so that a patient can feel much better. When it comes to joint bleeding, Madam Speaker, this thing is very, very painful. And we don't have capacities yet to diagnose and screen on time. And that would mean human resource for health to be looked into so that they can be posted in those proposed 47 facilities, one in each county. Lastly, which is very important, Madam Speaker, families do not know if it is not diagnosed on time and referred on time. That would mean retraining even our healthcare providers on how to diagnose and screen and refer them to time. It doesn't only affect the physical nature of human being. This thing has also psychological effects. That would also require, at least if we have one facility caring for these hemophiliac patients, then we should also recommend that we have psychological providers posted to these facilities so that the families can get appropriate counseling when they have these conditions to deal with. As a committee or as a house, I think it will be much of a due to want the ministry to do this. And in our committee, we are privileged to have the vice chair for budget, even if it means having a line item for this particular disease. There are only about 4,500 to 5,500 individuals. We could include funding for them so that when the donor support elapses, we can have our own funding and caring for our own people. Thank you, Madam Speaker. I think this is worth supporting, and I encourage all members, let's pass this quickly so that we can get it into action. Thank you, Madam Speaker.
Honorable Oundo, I think I've seen. Honorable Oundo is not there. You're number one on the list and you're not here yet. Yes, Honorable Member for Nyeri, I'll come to you next. Okay, I think Honorable Oundo, I'll let you settle down first. Okay, the Honorable Member for Nyeri, Honorable Mathenge.
Thank you, Madam Speaker. Madam Speaker, from the onset, I'm a member of the Health Committee, and we sat through this petition, and I stood in support of the report and the recommendations of the committee. Madam Speaker, this petition by the Hemophilia Society of Kenya goes to the core of our Constitution, in particular Article 27, equal protection and equal benefit of the law for hemophilia patients in this country. And when we superimpose that on Article 43, on the right to the highest attainable standard for health, and the report that the chair of the committee has laid before the House in terms of the absence of facilities, absence of medical supplies, absence of personnel, then we realize that as a country, we have a segment of our population that we have really disadvantaged. Honorable Speaker, preventable breeding is a health crisis for a family. For a hemophilia patient, it is an education crisis for a family with hemophilic students. It is an employment crisis for a family with adults who cannot go to work on account of bleeding that is preventable. It is a disability crisis because a person suffering from hemophilia, once there is onset, they are unable to do a lot of things for themselves. And this simply translates into catastrophic out-of-pocket expenditure for these households. Madam Speaker, the appeal by the petitioners was very simple. Treat hemophilia before it demands for treatment.
What does that mean? It therefore means that we should be able to provide the supplies that are needed to prevent the onset of hemophilia once it has been diagnosed. Madam Speaker, I want to thank the Federation of Hemophilia Humanitarian Program and other development partners who have really supported our patients in this country this far. However, donor programs cannot supplement, they cannot be the primary source of providing care. A national program should be in place, and the donor programs should complement the national initiative. Honorable Speaker, with the coming in of the ECCIF fund, hemophilia squarely fits within the conditions that should directly benefit under ECCIF. For this to happen, we need hemophilia to be expressly named with clearly defined service packages, medicines, and tariffs under ECCIF. Secondly, the transition from the other funds into ECCIF for hemophilia patients must be simple and clear. Madam Speaker, what does it mean?
You write the words. What if you could hear them as a song? Go to suno.com, switch to custom mode, and paste in your lyrics. Then describe the sound. I'll go with soulful R&B ballad, emotional vocals, piano driven. Hit create. Suno turns your writing into 2 fully produced songs. Your words sung back to you with real production behind them. Now shape it. Remix to hear your lyrics in a completely different genre. Rewrite sections to tighten the phrasing. Extend to build the full track. You can also use
early diagnosis, clotting factor replacement therapy, prophylaxis, and a national registry are very low-lying fruits for this country. Madam Speaker, I urge this House to support the report of the committee and support its speedy implementation. Thank you, Madam Speaker.
Honorable Zamzam, member for Mombasa.
Asante sana Mheshimiwa Spika, na mimi niweze kuunga kamati ya afya mkono kwa kuweza kuleta mjadala hapa bungeni. Mheshimiwa Spika, Mheshimiwa Spika, hemophilia ni ugonjwa ambao unagandisha damu, ambapo kwamba utaona mtoto ama mtu akikatwa kidogo damu inamwagika kwa wingi. Mheshimiwa Spika, huu ugonjwa ni ugonjwa ambao ni wa kurithi kutoka kwa mzazi. Na Mheshimiwa Spika, ugonjwa huu kutibiwa peke yake inachukua gharama kubwa sana. Unaona hata ile kutibu mtoto mdogo ni 50,000 mpaka 150,000, kwa mtu mzima ni 300,000. Mheshimiwa Spika, ugonjwa hauchagui maskini ama tajiri. Mheshimiwa Spika, kwa hiyo mimi ningependa kuweza kumunga mkono ndugu yangu ambaye ameleta hii bila hapa bunge, kusema kuwa huu ugonjwa unafaa utiliwe maanani katika taifa na bajeti ya Kenya. Mheshimiwa Spika, ili tuweze kupata katika mahospitali yetu, manake hawa wagonjwa kama hawa, hospitali ambayo inatibiwa hapa Kenya unapata ni hospitali 2 peke yake, wakati ambapo wagonjwa wako sehemu zote za Kenya. Mheshimiwa Spika, na mtu anaweza akapata jeraha, ama kwa mtoto mdogo anaweza kutairiwa ukaona anamwaga damu mingi sana mpaka kupelekea kifo. Mheshimiwa Spika, kwa hiyo kuna mahitaji makubwa sana kuweza kupata huduma ya afya katika sehemu zote Kenya. Kisha pia katika SHA waiweke kuwa hiyo katika magonjwa ambao ni yale magonjwa ya dharura, na ni magonjwa ambayo ni yale magonjwa mazito kama vile wanavyoweka high blood pressure, ugonjwa wa sukari, pia hii iwekwa katika ile msururu. Mheshimiwa Spika, ili hawa watu kupika pale hospitali waweze kuangaliwa kwa uangalifu. Mheshimiwa Spika, kwa hiyo mimi niweze tu kusema mmefanya jambo la maana sana. Huu ugonjwa vile ninaposema hauchagui, na mtu anaweza kuwa pengine amedungwa hata sindani ama amekatwa na kijembe, unapata damu inamwaika nyingi, na mtu hajui kama kwa mfano na huo ugonjwa, Mheshimiwa Spika. Kwa hiyo huu ugonjwa ni ugonjwa ambao watu wengi hawana ufahamu nao. Mtu anaweza kuona tu mtoto ana overbleed akafikiria pengine ni kitu cha kawaida, kumbe ni ule ugonjwa wa hemophilia, Mheshimiwa Spika. Kwa hiyo mimi napenda kuunga mkono na niseme mahospitali yetu ndani ya Kenya tupate madaktari kila sehemu na waweze kupata mgao wa kuweza kukabili ugonjwa huu, Mheshimiwa Spika, kwa sababu ni ugonjwa ambao unachukua pesa nyingi sana kuweza kuutibu, Mheshimiwa Spika. Na mimi niseme hata nikipata pale Makadara Hospital tukapata daktari na SHA ikaweza kusimamia vizuri, Mheshimiwa Spika, kama mama kaunti wa Mombasa, naweza nikashukuru sana. Manake wagonjwa wengi hawajui kuna maradhi ambayo yanatokea na hawajui kuwa maradhi haya ni kitu fulani. Kwa hiyo kama kuokoa maisha ya mtu, ni madaktari lazima wawe karibu na hospitali zetu ziweze kutoa haya matibabu ama hizi services za hawa wagonjwa, Mheshimiwa Spika. Kwa hayo nashukuru sana.
Before we go to the next